Judges, this is going to be Team 2. Team 2, Healical, right? Oh, they even got shirts made. Woo! This is technology from FIU. Please welcome Team 2.
It works. We're team number 2. Good afternoon. I'm Kerlin, and with my teammates, we are Healical. We're making healthcare more accessible, affordable, and effective for people. I'll need this. What we do, Healical is a cloud services provider for mobile and web app developers and remote health monitoring device manufacturers to securely manage their data collection, storage, and retrieval needs in the cloud. How we make money. There are two money chains that are available to us. One is patients working with their doctors in order to manage their care are looking to mobile devices to connect them with their doctors and to manage their treatments. Make sure they're following the prescribed treatments and also that it's happening the desired effect. And they will buy applications from the Android App Store, the Apple iTunes App Store, and those app developers will pay us for access to cloud storage. The second way is there are changes in the healthcare industry that insurers such as Medicare and Medicaid and also private insurers are forcing hospitals and accountable care organizations to improve care, and mobile apps will be important to that. Right now, I believe that Jackson Memorial Hospital is looking at losing almost $1 million for Medicare due to too many people being readmitted after their initial care. So hospitals like that are partnering with professionals in home health care to work with patients and lower the readmission rates. In addition to lower costs in that area, they're looking to mobile apps and devices to continue that monitoring. And so they will pay the app developers for access to the apps, and again, the app developers pass on some of that to us for access to the cloud services necessary to make it work. Now, a recent study noted that U.S. healthcare costs are heading toward over $13,000 per person in 2020. And forecast that digital health technologies will be able to save $1,700 of that, which is $568 billion annual savings, according to Bain & Company. In their words, there's an app for that. But today, few app developers specifically, have IT support. Many individual developers and even corporations that have IT departments are looking to leverage the cost savings and development time improvements through using cloud services. But these developers must and want to focus on the design of their apps rather than all the servers and communications necessary to store and retrieve the information. So, another study looked at the 40,000 plus healthcare apps on the iTunes Store and found that 90% of them have limited functionality. While chronic disease is the most costly component of healthcare costs today, probably 75%, or maybe $2 trillion according to the CDC. And they say these costs are the most preventable, and that's where apps come in. Healical H Cloud is needed by app developers if we're going to get close to these millions in savings. So Healical provides IT infrastructure for healthcare apps. Software development kit for mobile and web app developers, And the main things are HIPAA compliant secure storage and HIPAA compliant secure transfer, data transfer, and assistance with compliance with FDA registration and regulations. We say to developers, focus on your product, we'll focus on you. So as a company, we have distinct competitive advantages. First of all, we have a management team with strong experience in technology, finance, and marketing. And also, our mentor has a company that's experienced in developing web apps and cloud apps, and a team of developers in Latin America. Also, we intend to license the communications virtual machine patent for an international university. Think about it. There are lots of other general purpose cloud services. The cloud is a virtual machine, and it communicates, and they have a patent on that. But more than that, we hope to have association with the inventors there who have been working for a long time with Miami Children's Hospital and other healthcare providers in developing the technology. And another goal of ours is to be able to gain and share expertise in regulatory compliance to help the developers. Now, if you look at the competitive environment that we'll be in, it's spread over a wide range in several different dimensions. On the left-hand side, you see general purpose cloud services. And these are likely to be our partners, and they also prove out the business model. On the bottom left, there's some of the better known ones, Amazon and Rackspace, Google App Engine, and Roku. The top left are more recent phenomenon of cloud services focused on mobile back-end services. Companies like Convey, StackMob, and Parse. And their business model, they're able to charge developers several $100s a month for running small applications that cover a small number of people. And they're able to charge enterprises thousands of dollars a month. On the upper right-hand side, you see the 800-pound gorilla is Qualcomm Life. But in addition to that, you see there's a number of companies that are able to compete in this area. Two that are similar to what we intend to do are Catalyze and Healical. Both of these are new in the marketplace. Healical has been around since 2010, has about $7 million in funding, or no, excuse me, $700,000 in funding from Mark Cuban. And Catalyze just emerged from a startup accelerator in Wisconsin this summer. So, market trends. Chronic disease is the public health challenge of the 21st century, according to the CDC. And in response to this, payers are moving from reimbursement to accountable care. Two examples of that are programs, the Medicare Readmission Reduction Program and the Medicare Shared Savings Program. Through these, healthcare providers can expect to have either be penalized or possibly earn bonuses for improving care and reducing hospital readmissions. And on the mobile side, mobile health globally is experiencing 41.5% annual growth rates and expected to continue that for the next 5 years, with remote health monitoring being a large portion of that. We hope to capture 5% of the current 40,000 apps in healthcare that are currently on the iTunes App Store, and that will result in over $15 million in revenue annually. And to help with this also, there's been recent guidance from Health and Human Services on how to comply with HIPAA, and recent guidance from the FDA on medical devices. They're both trying to help accelerate this. So once again, we have three main products. The software development kit and the Healical Hub, the second two there, we sell one time to developers the software development kit. We sell to some users one time the Healical Hub for connectivity outside of a mobile platform. But we really focus on the recurring revenue from the H Cloud. You know, you give away the razor,
Time's up, Chris.
sell the blades. Here's our financial analysis. A lot of numbers here, but I want to just focus on our first year expenses. We're forecasting about $500,000, and we're looking at a break-even point in mid-2015, and in 5 years by 2018 to be near that $15 million in revenue mark that I spoke of as being 20% of the healthcare house. So we're close. We're seeking $500,000 for first-year expenses. We used to develop an H-Cloud database service and API, to develop the HSDK software development kit for mobile and web app developers, and to develop the Healical Hub product. And more specifically, in the near term, our goals are to build a minimum viable product, to form strategic partnerships with developers, and get the initial apps built. After that, we can launch marketing at trade shows and through the web and try to expand and advance our user base. This is our management team.
Chris,
And
gotta wrap up.
I'm wrapping it up right now. Thank you.
Hi. I have an investment on that area, and one of the biggest issues we had was the clearance from the FDA and also the other agencies in other countries, for example, Latin America, Brazil, and Europe. So how do you guys think on providing any sort of facility or any sort of help with the application providers to be approved on FDA, all the standards? How you guys will approach that?
Well, it's a complex area and we'll need legal advice, but currently the FDA has indicated that medical device data systems are considered, they used to be class 3 and now they're class 1, which means you don't have to go through a 510K procedure with that. Having that and to get that classification. And that can be useful in the traditional reimbursement schemes where you want to try and get paid by insurance companies. But we're looking at operating in areas of medical device applications that would not need to be regulated because they're not used directly for care. They're really to manage trends.
In your presentation, you mentioned the patent, the virtual.
Yes, Communications Virtual Machine is a patent from Florida International University. The patent itself was just issued last week, and we haven't worked very closely with them, but it's the technology could be very useful to us. And
Now, the idea of Healical, do you need that patent to work? Because it sounds like they're basically it's a patent on communications with the cloud. But if you didn't have, if for some reason that didn't happen, or the partnership with them didn't happen, can you still build Healical without that patent?
Yes, I believe we can. We have obviously competitors that are moving in that direction as well.
So what's the advantage of the patent? That's the part I'd like to understand.
The main advantage is if we partner with them and their experience and they're already working in this area, in the healthcare area with Miami Children's Hospital. They've done a lot of work in telemedicine and I'm at the inventors, our association with the inventors. It's to be determined whether we need it or not. The technology for, like I said, a communications virtual machine, their technology sounds very much like the technology used for uploading to a cloud and spreading the load across multiple servers.
Just to be brief, I like that you led with what you do and how you make money. I thought that was a great way to start off.
Great, thank you. We have good advice on that.
Okay, so I don't buy into your competitive grade at all. I don't see the distinctions as being medical device, general purpose. The way you laid it out made no sense to me. I see Amazon Web Services has a HIPAA compliant service. How do you compete against them specifically? Because they have name recognition.
They have name recognition, and they will help people to build HIPAA-compliant cloud services. But for a lot of app developers, that's a time and expense that they don't want to go through. They want to focus on developing their app and getting it in the marketplace and working on their value proposition. And so we want to be able to help them with that, with things that are critical to them.
Okay, thank you.